as we will use this time to give information about our efforts to provide 89 out of 95 of our counties more understanding, more guidance as they move toward a safe and methodical reopening of businesses here in Tennessee. We want to work, by the way, with the remaining 6 counties to make sure that those largest metro areas develop their own unique reopening strategy that will be complementary to the work that we're doing. COVID-19 is an unprecedented and a rapidly evolving threat that faces not only Tennessee but the entire world. The health and safety of Tennesseans remains our #1 priority. Much of our state's current success in this fight is because Tennesseans naturally choose to put each other first. They naturally choose to voluntarily adapt safe practices. It's that volunteer spirit that has been fighting this pandemic, and it's that same volunteer spirit that will help us rebuild our economy. I tasked the Unified Command Group and Tennessee's Economic Recovery Group with input from health experts, state and local partners, and business and industry leaders to build what we are calling the Tennessee Pledge. It includes specific recommendations which enable most businesses to reopen responsibly without the burden of heavy mandates. This will be a gradual return to business as usual with room to adjust as we evaluate changing data. The Tennessee Pledge asks businesses to provide safe working conditions that protect their employees' health and also protect consumers while securing their livelihoods. The plan also asks employees to commit to protecting themselves, their coworkers, and the customers that they serve. And finally, we encourage every Tennessee resident to be on the same team with our businesses, to act responsibly by following guidelines for social distancing, hygiene, wearing protective equipment wherever it's appropriate. Only by working together as a community of volunteers can we successfully reboot our economy, a vital component of our lives, our security, our liberty, and successfully move through this public health crisis. Each of our decisions throughout this pandemic have been built on public health data that informs just how this virus is moving through our state and affecting our citizens. As we work in conjunction with the White House guidance for safely rebooting the economy, we've kept a close watch on several benchmarks. We have been looking for a downward trajectory of both flu-like and COVID-like symptoms in emergency rooms all over Tennessee. And for the past 3 weeks, both flu and COVID symptoms have been on the decrease in almost every hospital in Tennessee. So we're meeting that important benchmark. For more than 2 weeks, we've seen a steady downward trajectory in the growth rate of COVID-19 cases. We also have stable hospital capacity all across Tennessee, and now we have the ability to test frontline healthcare workers without delay. Another key consideration for us has been watching how quickly the virus moves across Tennessee. There are a number of data points that we watch on a daily basis to identify trends over time that help us monitor the speed with which the virus is moving into Tennessee, and Dr. Piercy can address those in Q&A if those come up. While our health outlook, thankfully, continues to show signs of improvement in the fight of COVID-19, our economic outlook is very different. On the economic front, 15% of Tennessee's workforce filed unemployment claims as of this week. That's more than 400,000 Tennesseans without a job. In March alone, there was an $870 million loss in revenue across some of Tennessee's largest industries, like hospitality. As both employers and employees struggle, state officials predict a $5 billion loss in the gross domestic product for Tennessee in 2020. Many Tennesseans are not just facing potential sickness, but they're facing crippling financial hardship as well, particularly in the service industries. Our Economic Recovery Group in consultation with health experts and industry experts, has put together the Tennessee Pledge, guidance that protects employees and customers and works to streamline best practices. We've included general business guidance to ensure employers and anyone serving customers has an informed approach to safe reopening in the weeks ahead. Restaurants in 89 counties that are committed to operating at 50% capacity and committed to adopting these practices are cleared to open on Monday, April 27th. The series of guidance asks restaurants to space tables at least 6 feet apart, to keep bar areas closed for the time being, and we've also outlined safer ways even to handle menus and silverware. Although we are known for our music, we're asking that restaurants focus on safe delivery of food services for right now and don't utilize live music for the time being, especially as we work to socially distance. These are just a few examples from the guidance that restaurants across the state are receiving to inform them how they can protect their employers and customers while returning to business. Today, we've also released guidelines for the retail industry, which includes both retail stores who are reopening and those who have remained open as essential businesses. Retailers in 89 counties outside of the 6 counties of major metros will be allowed to operate on Wednesday, April 29th at 50% capacity. In addition to social distancing and sanitation measures, we're asking retailers to use gloves and face coverings, create more opportunities for social distancing by considering delivery or curbside pickup options, and even dedicate special shopping hours to the elderly and the medically vulnerable and healthcare workers. These are just a few examples of the measures that we're asking retailers to adopt as they welcome the community back into their establishments. Mark Ezell will be providing more information about these details in just a moment. Now, while this first round of guidance covers many Tennessee small businesses, we want to continue to issue guidance for others. Our approach to rebooting the economy, it must be steady and methodical and empower opening in a way that doesn't jeopardize all of the strides that we've made so far in attacking COVID-19. So next week, we'll give additional guidance to gyms, churches, hospitals, and physician practices. But I want to remind you, however, that there will be some businesses that will not be slated for potential opening until later in May. Close contact services will continue to be on hold for at least a couple more weeks. Barbershops, salons, tattoo, massage, services that are virtually impossible to socially distance while delivering. We're going to get those open as soon as we can, but we want to make sure that we have appropriate guidance in place and that we have an adequate supply of masks and gloves and other PPE before those businesses can open. Next week is important for Tennessee. You've heard me say it a million times, but I will continue to repeat it. Social distancing works, and it absolutely must continue if we're going to reopen our economy safely. Tennesseans, you have done what we have asked you to do, and we need you to keep it up a little while longer, and if we can do that, we can rebuild livelihoods while we continue to save lives. Until we have a vaccine, it is imperative that we all work together, each other, even in small actions like wearing a cloth mask or operating at half capacity. I thank Tennessee businesses for their willingness to put the well-being of their employees and customers ahead of everything else. And I also thank the industry groups and the health experts who have worked around the clock to develop and ensure that our Tennessee Pledge is practical and effective, will protect lives, and allow Tennesseans to go back to work. And now I want to invite Commissioner Ezell to share more about the Tennessee Pledge and the work that the Economic Recovery Group is doing. Mark?
Thank you, Governor Lee. It's my privilege to serve in this role. As a former third-generation family business owner and someone who's worked in the business community for over 35 years, I'm committed to restoring our state's economic health and getting Tennesseans back to work safely. As Commissioner of Tourist Development, I've seen the devastation firsthand as tens of thousands of my colleagues and friends at restaurants, hotels, attractions, and museums have lost their jobs. The economic shutdown has devastated individual workers and businesses, large and small. And thanks to the work of Governor Lee, the Health Department, Unified Command Group, healthcare workers, and all Tennesseans, we are grateful to be at a place where we can focus on getting Tennesseans back to work in 89 counties, with most businesses allowed to open next week. Our Economic Recovery Group has worked around the clock to outline these steps and guidance for a safe, careful, and phased reboot of our economy while following federal guidelines to protect citizens. Today, we're pleased to share the first look at our Tennessee Pledge with specific guidance for retail and restaurants and how to get them open safely next week in those 89 counties. The Tennessee Pledge is our commitment to help Tennesseans get back to work in a safe environment and restore their livelihoods. I want to be clear, we are not returning to business as usual. Within the guidelines released today, we ask that businesses allow employees to continue working from home whenever possible. We want to take steps to protect customers and employees, like temperature checks, cleaning and disinfecting protocols, and wearing cloth face coverings. We want to continue to practice social distancing and avoid gatherings where appropriate spacing is not possible. Together, we must pledge to adhere to these important guidelines to keep our families and neighbors safe. So starting Monday, restaurants will have the ability to operate at a 50% capacity under the guidance we're sharing today. And on Wednesday, retail will have the ability to operate at 50% capacity. Economic health is important to the livelihoods of all Tennesseans, and our Economic Recovery Group will continue to work on communicating, collaborating, connecting with industries to get Tennesseans back to work in a safe and healthy environment. The ERG collaborated with associations that represent over 100,000 businesses and over 2 million Tennesseans. This is not a one-size-fits-all approach, so we'll create guidance according to need. And we want to be clear, as the governor has said, not every industry will be able to reopen safely now or all at once. It's like a dimmer switch, and we are installing dimmer switches in all of our industries. This will be a gradual return to business, and additional plans will be provided over the upcoming days. So I want to say thank you. Thank you for the feedback from the health experts, state and local partners, business and industry leaders, and from you, for we received responses from over 1,500 Tennesseans in 73 counties. And along with numerous legislators' feedback, we've taken this feedback and accounted it in our plans for this phased approach. Our Economic Recovery Group will work unified command, which includes the Department of Health, and adjust as we evaluate changing data. Continued testing and contact tracing are critical to ensure that we can reopen the economy and mitigate the spread of this virus. So this is a careful, data-driven, phased approach because the health and safety of Tennesseans is our #1 priority, including restoring our state's economic health. And I'll be happy to answer questions. Thank you, Governor.
Thank you. Thank you for joining us this morning. There is much information to know about the details regarding this Tennessee Pledge and its plans, and we'd like to answer any questions regarding that this morning. So happy to open up. We also have Dr. Piercy here with us today to help with questions, health questions. We have members of Unified Command Group and Commissioner Ezell of our Economic Recovery Group. So let's get started with questions.
Thank you, Governor. First, we'll go to Kim Crucy with the AP. Kim, your line is open.
Hi, Governor.
Thank you.
So I guess my question is, how are these guidelines going to be enforced? What is the state's role in making sure that restaurants and retailers are actually following these best practices?
You know, part of this whole approach, Kim, is the gradual lifting of mandates and restrictions and sanctions. That's how we want to get our economy started back. As businesses open and follow guidelines, customers will be safe to enter those businesses and will feel safe. And we expect that businesses will take and commit to and post this pledge to take care of their customers, and that will provide for how those businesses will display and will commit to being that safe environment.
Yes, thank you, Governor. And it's an important question that you raise, and we believe the Tennessee Pledge will allow us a mechanism for businesses to rally around providing safe environment for their workers. Also, businesses will be able to display their commitment to the Tennessee Pledge not only for their workers, but also for consumers. And we think that they are committed to providing those safe steps with PPE and pre-check temperature screens and other commitments around social distancing that will protect folks as they begin to visit those businesses. And we feel confident in our community's response to this.
But as of right now, there is no intention of the state to enforce these best practices.
We think that the consumers will enforce them, the business community itself will enforce them, the industry groups that have influence and impact and develop guidelines for industries. That's how this is going to be enforced. Really, what we know is that in the same way that Tennesseans came together to put us in the position to be able to begin to reboot our economy, we know Tennesseans once again will put us in the position to have our economy start back up.
Thank you.
Next, we'll go to Joel Ebert of the Tennessean. Joel, your line is open.
Yeah, Governor, aside from Dr. Piercy and others in your administration, which specific medical doctors or experts did you talk to while coming up with this plan? And then this week, it sounds like your administration told state lawmakers that you're working on securing 5 million masks for every Tennessean. Why go ahead with these reopenings if you don't have CDC recommended potentially life-saving masks for all Tennesseans?
Yeah. So we know that most Tennesseans, many Tennesseans, thousands of them already, have found masks for themselves. We expect that to happen, but we want to use this order of 5 million masks to encourage even broader use, to make it easier, to remind people of our commitment along with theirs to following guidelines that are going to be a part of the new habits that we need to make sure we're doing. So, so we're hoping to actually supplement what Tennesseans are already doing. And as soon as those masks get here, it'll make it even easier for us to consider the opening of more businesses down the road. So it's all a part of our phased reopening. Regarding doctors, we've been working with the Tennessee Medical Association, the Tennessee Hospital Association, health experts in other, even input from health experts in other states, from epidemiologists in our states, with CEOs from major hospitals in each major metropolitan area. So there's been a number of ways that doctors and healthcare officials have provided input into this strategy.
Next, we'll go to Sergio Martinez Beltran with WPLN. Sergio, your line is open.
Thank you, Gilliam, and good afternoon, Governor. Governor, you have talked about how your administration is looking at the growth rate and the steady decline of the growth rate as one of the metrics to reopen. But the reality is that that growth rate for the last few days has increased. So I'm wondering, if that's actually the metric you should be looking at to reopen. And if not, can you explain a little bit your process behind that?
Yeah, thanks, Sergio. There are a lot of metrics that we look at, that being one of them. Dr. Pierce, you want to talk about that trajectory and how clinicians look at that?
Sure. The governor just said a key word, trajectory. Another word you can use is trend. And you're exactly right. The numbers over the last 2 and perhaps even the last 3 days are a little bit higher, and it tells you exactly why you have to take that into context. Over the last 2 or 3 days, we have added the results from our mass prison testing, specifically in Bledsoe County at Bledsoe Correctional. They've had a high number of positives. That's what we call a high yield population. And anytime you do testing in a high yield population, which is where you expect to get more positives than you would in the general public, those numbers are going to be higher for that day. I can't stress the importance of not focusing on just one metric and not focusing on just one day. That's why we look at multiple metrics over the course of about a 14-day period to determine a trend, because we do expect to see some blips in that. Just as if you were watching the stock market or anything else, you can see a trend over time, but not put too much credence into one particular data point.
Well, Commissioner, so, you've also talked about how when businesses reopen, the state is going to see an increase in cases. How are you going to still look at those metrics and still get to the conclusion that the right thing to do is opening when you're still seeing more cases popping up every day?
You make a good point that we are not done looking at data. In fact, I would submit that we need to be more cognizant of how our trends are moving now, even than we were before. So we're looking at things like day-over-day growth rate. We're looking at a metric that you may have heard us called, sometimes it's referenced as R0 or R subscript 0, which is the reproductive rate. That is the transmission score that is now at about 1.0, but has been much higher in the past. We also look at the overall positivity rate, so how many positive cases we have relative to all of the tests we've done. So lots of different metrics to look at, again, not just one and not just one day.
Governor, thank you, Commissioner.
Thank you.
Next, we'll go to Chris Davis with News Channel 5. Chris, your line is open.
Good morning, Governor. The Tennessee Medical Association has recommended a county-by-county approach for reopening. Have you considered that approach? I also wanted to ask you, Tennessee has tourist destinations across the state. What is your message to out-of-state visitors? When is it okay to come back to Tennessee?
I'm going to let Commissioner Ezell talk about the specific message and around our tourist destinations and when we expect those tourist destinations to be opening. Your first question, the Tennessee Medical Association suggested a county-by-county approach. We've also been working with the Tennessee Medical Association in our opening plan, as I said earlier, along with the Tennessee Hospital Association. And what we believe is that the strategy of 89 counties, which are the lowest population counties in our state, so that there is a clear understanding across the state of the plan, so that we don't have a confusion across the state about different plans in different areas. That's really been our strategy, recognizing that our 6 major metropolitan areas have unique circumstances, which is why we want to work and have been working with the leaders from those metropolitan areas to make sure that we have a complementary opening strategies. But we believe that the efforts and the phased-in strategy, the geographic approach that we're taking is the one that's right. I'm going to let Commissioner Ezell speak to your tourism question.
Thank you, Governor. Here's what we know. What we know is that in those 89 counties, 170,000 people are employed in retail. And we know that 150,000 are employed in restaurants. This week is about opening up those opportunities for some of those people to be able to get back to work. Here's what we don't know. We don't know when we will have solutions for the tourism industry regarding tourist attractions. And so in that careful phased approach, we've implemented a strategy that allows us to be able to get Tennesseans back to work, and we continue to evaluate and work through guidance so that we can, when it's time, help those tourist attractions and others be able to get back to work. We know right now we are not encouraging travel from other states to come into our communities because in this careful phased approach, our most important priority, again, is the safety of all Tennesseans, but also helping those Tennesseans who have lost their jobs have the opportunity to get back to work.
Next, we'll go to Shannon Sharp with WTVC. Shannon, your line is open.
Governor, Hamilton County has been behind in testing since this began. Are you concerned about that with reopening? I know the county mayor has said they plan to reopen along with your guidelines. The city mayor is not, but is that a concern since we're lagging with to keep up with other counties in the state?
Certainly, Hamilton County has made significant improvements in their testing capacity of recent, and they in fact, were very helpful in bringing online the Baylor component of our testing. Dr. Piercy, you want to comment specifically about Hamilton? I'll comment broadly about the state. We, as a state, are continuing to heavily expand our testing. We have pop-up testing sites all across this state. And one thing that's important to know, when we have testing shortages in certain regions, we're able to take the locations where we have surplus and bring them to areas that have a current shortage. We've done that in every metropolitan area and every county across the state that's had a problem. And we feel really encouraged about the testing capacity, not only in Hamilton, but across the state. You want to talk specifically about that?
Just a brief comment on Hamilton County testing. We had weekend events planned for last weekend, but due to the tornadoes, we postponed those to this weekend. We have pop-up sites in Hamilton County over this weekend, both Saturday and Sunday. Encourage you to go to our website to get specific time and location details and invite anyone who thinks they need a test to come get a test. We're also in contact with the local health officials as well as the local health care system leaders there to help facilitate testing supplies that they may need there. So I think we're making big strides in Hamilton County and continue to and will continue to support them.
Next, we'll go to Sam Stockard with the Daily Memphian. Sam, your line is open.
Yes, thank you, Governor. The state right now has been distributing these grants to rural hospitals, yet the rural counties have very few COVID-19 cases, and in fact, some hospitals are reporting furloughing employees. It seems almost as if the state is paying hospitals not to operate when they could be doing elective surgeries. Now, what's the thought process behind that? And why not go ahead and open up these hospitals and the dental offices for elective procedures?
Yeah, that's a good question, Sam. And I said in my comments that we would be giving information on those elective procedures and the opportunity for hospitals to begin those next week. So you'll be getting guidance. You'll be hearing about that guidance and the specific date when those procedures are going to start. But we're working with the hospital association themselves to get those opening times and those guidance just right. But we are providing assistance to our rural hospitals because they are, because of the suspension of these elective surgeries, it has put a financial strain on them. And we need those rural hospitals to continue to operate in those areas. Even though rural counties don't have the mass numbers of cases, they will have cases. and there will be need in rural communities for healthcare associated with COVID and other health-related issues as well. So keeping those hospitals operating is important to the people that are in those communities. And I'm pleased that we have worked with and delivered the first round of grants for those. We're delivering the second round of grants in the coming days. We've also been working with those rural hospitals to leverage and to access the federal dollars that are available to them. So they are a very important component of our healthcare system in this state, and the capacity that we need to make sure is there for whatever COVID cases come down the road, and that's been our approach.
Has there been any thought into providing grants for the hospitals, say, in Memphis and Nashville, where most of the cases are?
Yeah, there's a significant amount of, or certainly an important amount of federal funding that's coming as a part of these 4 phases of federal dollars coming down through the CARES Act that's going to actually provide funding directly to hospital providers all across the state. Those dollars will be forthcoming, and that'll provide assistance specifically to hospitals in every part of the state.
Thank you.
Mm-hmm.
Next, we'll go to Grace King with WBIR. Grace, your line is open.
Hey, Governor, you mentioned next week will be critical. If the state's numbers do start to rise again, at what point are you going to consider reversing these measures or putting stricter guidelines back into place?
Yeah, you know, in the same way that we follow data to make decisions about how it is that we got us to the place where we are today, the data decisions that really drove our fight to slow the spread of it, that's that same kind of data that we will watch going forward. And we will make decisions about particular issues as we see something happen. It's very difficult to predict what those will be, where they will be, what that will look like, but we're very committed to the health of Tennesseans and to the public safety. That's the utmost commitment. That's the utmost priority. When we start looking at data going forward, as we begin to open our economy, that's what we're going to be looking at. Where do we have any risk that is getting to a place that needs to have some sort of different action than the action we're taking, and we'll take it when it's applicable.
Next, we'll go to Alex Apple with Fox 17. Alex, your line is open.
Governor, 2 quick questions for you. You just mentioned a second round of grants for rural hospitals. Do you know how much that will be? And secondly, did you provide a notice to local law enforcement agencies that they can police this how they want to, akin to how you did several weeks ago when you put the stay-at-home order in effect as a mandate? Is that a similar scenario now?
Yeah, so this is, as we said earlier, we're going to be putting this Tennessee pledge out there, not as a mandate, but as a set of guidelines and as best practices that will allow these businesses to take that pledge and allow consumers to know which businesses have done that. That will provide the kind of safe environment that we have out there, Alex. What was your first question?
How much, do you know how much money is going to be in the second round of funding for rural hospitals?
Well, the total amount is $10 million. And the specific amount of the second round I don't have. We're getting applications and have already received applications from those providers for those grants. Part of what we're using that grant money to do is to leverage federal dollars, so that when those small hospitals get one of these grants from the state, it allows them to be matched with federal dollars. So we look at the individual needs of that hospital to create that grant process. But I don't have the specific numbers around those grants or the amounts they'll be, but the total pool of that available to those rural hospitals is $10 million, which actually leverages significant more than that in federal dollars.
So it's more than a one-to-one match scenario?
Many times it is more than a one-to-one match. I think in our first round we talked about the hospitals receiving, or the first grant receiving $1 million and pulling down $7 million. That's not a formula. That was a particular circumstance, but there are there are significantly more federal dollars going to healthcare providers than state dollars. But this $10 million in state grants was to be a bridge between the time that these hospitals needed the operating dollars and the time when the available federal dollars would be delivered. We wanted to bridge that gap, and that was the goal of these grants.
Next, we'll go to David Floyd with the Johnson City Press. David, your line is open.
Hey, Governor. I think you had mentioned that you're anticipating to release more guidance for hospitals and physician groups next week. But is there anything you can say now about what that guidance would entail when it comes to elective procedures, access to facilities, and visitation?
Yeah, I wish I could give more information, but what's most important is that we give detailed information. When we deliver that information, we want it to be clear so that people understand exactly what's necessary to go back safely to procedures and surgeries. And so we're working with the healthcare community right now to develop those certain, clear, detailed, safe guidelines, and they'll be available in the next few days. We can't deliver those yet because they're not ready, and we want to make sure that people are safe and that the facilities are safe, and that's why we'll be waiting a couple more days to deliver that information.
Okay. And are there still restrictions in place on elective procedures currently?
There are. Those restrictions currently are in place to the 30th of April. I believe that date's correct. I'll have to look back at the executive order, but we'll be providing information on when those procedures will be able to be safely returned to, and we expect that'll be in the next few days.
Thank you.
Mm-hmm.
Next, we'll go to Chris Bungard with WKRN. Chris, your line is open.
Good morning, Governor. It's been a while since we've said that. Here's my question.
Yeah, you're right.
Would you yeah, somebody said good afternoon.
That's right.
Well, I understand that sometimes you can get these things screwed up, but would you urge Tennesseans to get out and eat in restaurants on Monday and go shop on Wednesday?
Oh, I want Tennesseans to know that that we want our economy to open up in a slow, measured, stepped approach. I want Tennesseans to have the opportunity to do that. That's what I want. I want people to feel safe. I want businesses to provide a safe environment. I want business owners to have the opportunity to begin creating livelihoods for their employers and for their own families. All of those are the things that we want to happen, and I would encourage Tennesseans to engage in that as they feel so fit.
And I had one more question, if I can slip that in. There were a lot of big numbers tossed out at the beginning in your remarks. I've asked this before, but it may be changing each day. Or what about the state budget? The emergency budget was passed. Does it look like that maybe have to be readjusted at this point, or is it too soon?
You know, because the real data from the revenues for the state are not complete. I mean, we're just beginning to understand. It's too soon to say with certainty what's going to happen, for sure. It's not too soon to say that we know that there is going to be a significant downturn in this economy. As we said earlier, there are predictions of a $5 billion loss in gross domestic product in this state. That will mean there would be major revenue loss to our state. And our budget will have to be evaluated with that as a backdrop. Now, the legislature is due to reconvene in June, and that will be the primary responsibility of the body as they come together and we work together to make decisions about our state's budget. That work is already being considered. We've already begun talking to leaders in the legislature about what those projections might look like and what those decisions will be. So it's not too soon to say that it will clearly be one of the most important lines of business for our office and for the legislature in the days and weeks and months ahead. It's a little too soon to know what those numbers might be.
Thank you.
Yes, sir.
That's all the time we have for questions this morning. Governor, if you would like to make a closing statement.
Thank you very much. Thanks for joining us for this special morning briefing, a very special briefing indeed, because it is the day when we can celebrate what Tennesseans have done and congratulate Tennesseans for the efforts that they have made to mitigate and slow the spread of COVID-19, to get us to a point where we can begin the process of gradually reopening. But we only celebrate that because it has gotten us to this place. What we also say is it's time to re-engage in a greater way. Now more than ever, Tennesseans need to do their part to stay apart and make sure they socially distance and follow the guidelines and wash their hands and stay home when they're sick and do all of the things that are going to allow us to continue down this path, to continue to open more businesses, to continue to put more Tennesseans back to work, and to continue to move to the place that we want to be in the midst of this pandemic. Very grateful for the work that's been done, very grateful for this day and the place that we're in, and very hopeful for the future. Thanks for joining us.